I'm Dr. Scott Jensen. What have we done? I just finished a house call on a patient who's in his mid-80s. He did everything he was supposed to do. He got vaccinated with 2 shots in the spring of the year. He got his booster in the fall of the year. I saw him in the office about 3-4 weeks ago, and his antibodies for the spike protein were greater than 800. He's got COVID now. His wife had COVID last week. He's not doing so well. And I didn't feel comfortable having him come in the office, and the emergency rooms are overwhelmed, so it's easier for me to go to him. So we put him on some medications, and we'll watch him closely. Yesterday, I did a house call on a 50-year-old woman who was furious with the fact that the doctors and staff that she would have expected to help her weren't there for her. So it was easier for me to go to her house because she wanted to stay out of the ER. I have had legislators and nurses calling me for the last 72 hours, begging me to get involved with hospitals and their policies around the state of Minnesota. Many times patients have felt imprisoned in a hospital. Families have felt like they couldn't get their loved ones out of the hospital, and they were frantic because in the hospital, if you will, the menu of options for patients was so limited. Patients are just frantic. Doctors have not been there for them. The patient-doctor relationship has not stood the test of time during this COVID pandemic. Last night, I dealt with a patient whose 23-year-old nephew hung himself a few weeks ago, and 2 of that 23-year-old nephew's buddies had killed themselves in the preceding 2 months. We're seeing the CDC narrative fall apart. We're seeing the isolation period reduced to 5 days instead of 10. Based on what science? We're seeing NFL players going back and playing if they're not symptomatic. We're seeing if you're exposed to someone, you don't have to not go to work if you're asymptomatic on the 5th day, but you should wear a mask for another 5 days. Isn't it time just to step back and say, gee whiz, what have we done? Were we measured and thoughtful? Did we really let doctors and patients do the best they could? Didn't we go just a little hell-bent crazy, allowing the bureaucrats to just pick and choose and throw mud on the wall to see what would stick? This patient I just got done seeing has powerful antibodies, and yet less than 2 months after he got his booster, he's got COVID. We've got to get back to the basics, and that's a patient-doctor relationship, and we've got to be there to serve our patients. What have we done?